One by one, over 25 girls got to explore the construction field on Friday.
At least get some more girls into the trades.
Joslyn Mocine is a sophomore at Hortonville High School. She has some male family members who work in construction. Joslyn is interested in pipe fitting after college. She'd be the first woman in her family to join the industry.
There's a lot more girls, I feel, they thought it was scary or it was like a man's job. Now they're seeing they can do everything and it's a lot easier.
Becca Schleyer is a senior project manager at Miron Construction. But for the Build Like a Girl event, she is a mentor to the students. She's been in construction for 25 years.
When I started, there was hardly anyone. So it's exciting to see more women coming in.
A statistic from Miron Construction says women comprise 9.9% of the construction industry, with only 1% of laborers in the field working hands-on being women.
But if I would have had this opportunity like the girls do, I would have been able to focus my education a little more, work on different internships.
Executive Vice President of Human Resources at Miron Construction, David Walsh, says Build Like a Girl started 5 years ago. It's seen a couple of participants go into the field, but has sparked dozens of interest.
The best case scenario is that they had a great day and learned something. For us, the best case scenario is 2 or 3 of them say, you know what, I'm going to give that a try.
One thing girls will practice is masonry or operate a boom lift.
I'm always like, construction sounds right, but what do I know?
After taking a boom lift for a spin, Mackenzie Summers likes the idea of pursuing construction just like her dad, who works at Miron. She says after Friday, girls should feel like they belong in the construction industry too.
What was once an economic engine for the city of New Holstein is now meeting its demise. Demolition is almost entirely financed by state grant dollars. Community members gathered around in what was described by all as a bittersweet day. One redevelopment plan is set in stone. The mayor hopes it will bring more opportunity to the city.
Part of the grant funding is we do have to come up with some affordable housing, so that's number one on our list.
Citizens from all over Wisconsin would come to work at the plant from Fond du Lac, Manitowoc, and Seymour. Even Michigan natives would relocate for a chance at employment. Former workers were in attendance to bid one last farewell and to also give thanks for what it has given them.
Well, it put my kids through college. It was a good living. I bought my house, I bought cars. Yeah, it was a good place to work.
Eugene is also encouraged that the site will be used with the community's members in mind.
At least it's being used for something good. I mean, instead of just standing empty, I'm glad that the city was able to get the financing and stuff to eliminate the eyesore that it is now. I mean, at one time it was such a prosperous, big, beautiful place, and if you aren't going to take care of it, it's a good thing that it does move on.
Mayor Jeff Hebel says that the demolition is long overdue, but it's offering a glimpse into the future.
Many districts have already decided whether masks will be required, but are also ready to change course. The school year was one of the topics discussed in the latest DHS briefing.
Never been more difficult to be a school board member in the state of Wisconsin during the pandemic, and in addition to right now as we're hopefully are starting the process of ending the pandemic. I know school board members have to be responsive to the people that elect them and to put them in charge of kids' education. But at the same time, they also have some obligations around following the science.
Emergency physician Dr. Brad Burmeister with Bellin Health joins us live via Skype. Good morning.
Good morning.
Well, let's start talking about schools. Do you think all schools should mandate masks?
I think nobody likes the word mandate, but I think, we want to provide education so that people feel, essentially compelled with the currently available evidence to have their kids wear masks in school. Our primary goal is to try to keep kids in school, as much as we possibly can without having symptoms or infection with COVID, and the evidence supports wearing masks to keep that as our goal.
Doctor, there's concern about the Delta variant, the dominant strain right now. What are you seeing, and what are hospital numbers like in our region?
Yeah, we're certainly concerned with the trend in cases that we're currently experiencing. I wrote down some numbers here. Currently across our state, we have 600 people in our hospital. At our peak in November, we had 2,200. So we're about a quarter of the way there, which is pretty substantial. In our region currently, we have roughly 50 people in our 7 or 8 county region. And, just a month or so ago in July, we were all the way down to 5. So that's pretty striking growth. We are doing everything we can to prevent this trend from continuing because, if we continue to grow the number of cases, I think it's going to be very concerning to our community.
When we talked about hospitalizations in the past, the focus was on keeping the older population safe. Has that focus changed, or now are we talking about children, keeping children out of the hospital?
That's a great question. Certainly, we know that COVID can infect anyone of any age. I think we continue to focus on people who are perhaps elderly or have vulnerabilities, or people who have had organ transplant or have other immunodeficiency disorders where the vaccines have been shown now not to be quite as effective as we'd like to see and wane a bit with time. But our focus, is on the health of everyone and our entire population and community.
Some medical experts who believe if you have recovered from COVID and have natural immunity, that vaccinations aren't necessary. What are your thoughts on that?
Right. So with the evidence currently available, we know that having a recent infection with COVID-19 offers some protection against future infections. We also know that there's breakthrough infections with people who've had COVID in the past where they can acquire it again. So the current evidence suggests that if you've been infected before, if you give it 90 days or so, it's very reasonable to pursue vaccination at that time to sort of maximize your immunity and prevent infection again.
Big news overnight, Doctor, was that the FDA gave approval for the extra dose of the Pfizer or Moderna vaccine, approved for some. Who falls into that group?
Right. So the FDA is saying that they expect roughly 3% of the population is going to be a candidate for a third shot or that booster dose. We're awaiting probably the CDC today will give us a little bit more guidance on exactly who that will entail. So far, they have specifically said people who have had a solid organ transplant, like heart or kidney transplant in the past, because those people take anti-rejection medications which suppress their immune system so their body doesn't reject the organ that was transplanted to them. And by taking those medications, it really impacts their immune system's ability to make antibodies from a vaccine.
So that's for the Moderna and Pfizer, but we haven't heard about the Johnson & Johnson one-dose vaccine.
Yeah, I think they're still sorting through the evidence with the J&J to see what would be the best pathway forward and what is the implications to people with that vaccine, because it's a slightly different technology than the mRNA vaccines, the Moderna and the Pfizer vaccine. So I think the question there remains to be seen at this point.
So what do you tell people? I guess that whatever vaccine they've gotten, just wait and see what the results are of the study?
Yeah, I think I would wait to see what the results are of the study. We know that people continue to have at least some degree of immunity at this point, really with all of the vaccines. We expect to have some degree of immunity. It's not like you're down to zero again. But, we like to have these things really well understood before we make recommendations as a medical community to ensure that things are safe and going to be effective and worthwhile for you.
I'd like to ask you about the protests this week against vaccine mandates in hospitals. They've been happening all week long in Northeast Wisconsin. One of those protests right outside of Bellin. Can you talk about this, what seems to be a divide among healthcare workers?
Right. So, certainly understand that this is a extraordinarily complex issue and people have very strong emotions on both sides of it. At Bellin Health, we are working towards educating and talking with all of our team members to help them understand why we believe that vaccination is so important. And we currently don't have a mandate, but, in the setting of the Delta variant and the trend we're seeing locally, we continue to reevaluate that position.
And what do you say to people who are going to the hospital for treatment? How's their care going to be in a situation like this?
Right. So overall, the hospital is a safe place. We have masking we do. A lot of times we wear gowns, we wear face protection, a lot of hand washing. There's good ventilation for people who are in the COVID-19 unit where the air is filtered. It doesn't go to the rest of the hospital. So people should feel very comfortable seeking healthcare at this point, particularly if they themselves have been vaccinated as well.
All right, finally, I'd like to ask you about football. Everyone's excited that football is back. Lambeau Field is going to be full with fans. What advice do you have for those going to tomorrow's game and even to big other summertime events like Burger Fest in Seymour? How do we stay safe?
I love that you threw Burger Fest in there, as I grew up in Seymour. I would just recommend, be smart. Hopefully you're vaccinated at this point. That's going to be the best bang for your buck at this point to prevent a COVID-19 infection. Of course, if you're going to be in an indoor setting, or maybe even if you're going to be outdoors in a really tight packed area, wearing a mask is not something that's unreasonable there. And if you're indoor, we definitely recommend it for all people in areas that have higher substantial transmission, which most of our region is right now. So we'll just use those public health measures that we've been practicing all along to mitigate your risk or try to prevent COVID as much as you can, so that we can all be in good shape as we send our kids off to school this fall.